I'm excited and delighted to moderate this third and last day of the 2023 HITLAB Innovators Summit. And for me, the journey into digital health has been one that has transcended over decades. I have some nice titles which allow me to interact and meet some really brilliant and talented people. But at the end of the day, and the end of the day for a clinician is what I am, which is really the next morning because it happens all night. I'm a clinician and I take care of patients. And I see outpatients 3 times a week. I spend several months rounding in the cardiac care unit because I'm a cardiologist by trade. And for me, it is all about patient care. I work at SUNY State University of New York Downstate Medical Center, which is located in central Brooklyn, a borough of 2.8 million people. And if you think about that for a minute, we are one college of medicine serving 2.8 million people. Long Island, Nassau, and Suffolk County have approximately the same number of residents and have 4 medical schools. Manhattan, some 3 million residents, which swell to over 6 million people during rush hour to work, and there are 6 medical schools. So when you look at those ratios, the mission of Downstate is a very important one. And our prime mission is serving the underserved. And that is one of the things that has attracted me to digital health. Technology, which is used as a tool to help us provide care, which can either improve or exacerbate healthcare inequity. My interest started back in 1997, and I started working with Stan Kechnowski in HITLAB. At that time, Yahoo was the predominant internet provider. The only online trading company, I think at the time, was Daytech, if you remember that. And I remember my first cell phone, and it was about the size of a shoebox and weighed about as much as a brick. And I was interested in polling my patients. The average age was about 66, and about 70% of them had used the internet, this relatively new phenomena, to seek information. 90% were via internet. They were using emails, I should say. About 30% were shopping at that time, and about 30% were seeking healthcare information. And remarkably, of those 30% that were seeking healthcare information, 90% didn't do it directly. They actually had first-degree relatives that were doing all, younger ones usually, that were doing all of the research themselves. So we concluded that if one wanted to target a disease management program, they shouldn't go after the patients themselves, but actually after their relatives. Well, decades later, digital health has blossomed into a number of domains. And I must say that I am still a digital health enthusiast, but as someone who sits there struggling with the electronic medical records, various other applications, signals that patients bring in to me from wearables, sometimes that are decipherable and sometimes are not. I am both a digital health enthusiast, but I am a digital health realist. I've had the good fortune of working with many people, and my lab does a lot of validation work in terms of new technologies. So when I was asked to chair this last and final day, I jumped at the opportunity to witness firsthand innovation. I find this to be an incredibly a critically important session, but also a very exciting one at that. So having said that, once again, I welcome our guests, I welcome our speakers, I welcome our virtual guest, and to our Muslim colleagues throughout the world, I wish them a very good holiday, Eid Mubarak. Thank you. That's right. Good morning. Why don't we all say it one more time? Good morning. Good morning. That's right. This is Manhattan, but it's also part Brooklyn. Thank you. Made me feel at home. Our first speaker is Dr. Jacques Jospitri. Dr. Jospitri is a psychiatrist who has long been interested in the application of technology, learning theory, and organizational psychology to the delivery of mental health services. He is the founding partner of Soho MD and is a Northwestern University alumni. The title of his talk will be Looking at the Right Data to Better Treat Psychiatric Patients. Dr. Jospitri.